Hi everybody, hello, I'm Jewel. Welcome to my channel. I did a video, the first video, talking about a patient of chronic kidney failure, and they all come with a healthcare team. And so the first person, of course, is the doctor, which is a nephrologist, an advanced practitioner, a nephrology nurse, a renal nutritionist, which is a dietitian, a nephrology social workers, which we stopped in the first video. So I'm going to pick it up with the patient care technician and renal technologist. There are two kinds of technicians in the dialysis facilities. Patient care technicians are renal technologists. Both work under the supervision of the nephrology nurse or nephrologist. Patient care technicians are often the healthcare team members who are most directly involved with the patient's daily dialysis treatment. And many dialysis units, they are responsible for starting and ending dialysis treatments and for monitoring patients before and after treatments. Renal technologists or technicians are responsible for maintaining dialysis machines and water quality in the dialysis facilities. They order dialysis supplies and perform reprocessing of dialysers' artificial kidneys, of course. There's the secretary or the unit clerk. Often these are the first people patients meet when they come to a unit. They can answer your questions or direct you to the appropriate healthcare team member. Financial counseling or bill personnel. All transplant facilities have financial counselors, and most dialysis facilities have billing personnel who can answer questions you may have about insurance, coverage, and billing of payments, and any questions. And of course, the most important person, which is the patient, which is you. You and your family are the most important members of the healthcare team. You can take an active role in your care by learning all you can and cooperating fully with your treatment plan. At first, you may be somewhat overwhelmed by your illness and by all the new names and faces. However, you and your family should not be afraid to ask questions. Each and every person on the healthcare team is there to help you feel your best. And guys, they really are there for that reason. So lean on them. The transplant team. This is another person that is a part of your team. If you are a candidate for a kidney transplant, your healthcare team will also include the following: transplant surgeon. These doctors have advanced training in general surgery or urology. They will perform the transplant operation and answer any questions you may have about the surgery or about the follow-up care. The transplant surgeon and your kidney doctor will take care of your follow-up care after the operation. The clinical transplant coordinator is another part of your team. The clinical transplant coordinators are the patient's link to the transplant hospital. Many are licensed, registered nurses or physician's assistant who have specialized experience in the care of kidney transplant recipients. Clinical transplant coordinators assist patients with all the details of their care involving in preparing for transplantation. The process includes scheduling tissue type tests, educating patients and families about the risks and benefits of donation and transplantation, scheduling the operation and arranging the checkups before and after transplant. Clinical transplant coordinators also serve as information resources for patients and families after a transplant. And your last one is your donor coordinator. Donor coordinators serve an important role for patients who are waiting for a transplant. They participate in every aspect of the procurement and the procedure, including obtaining consent from families of organ donors, donor maintenance, and the distribution and preservation and transplantation of organs and transplantations. So guys, these are the people that are part of your team, your everyday team that you will be coordinating with mostly for the rest of your life. So I would say to you all to, get to know these people that are going to be a part of your life. Most of them, I'm telling you, all of them are so great. They helped me through all of my journey, and I leaned on them very, very heavily. And they were very, very good to me. So I know that they will be very, very good to you. So all I can say for you guys is, this is your team. Lean on them. Ask questions. They're there, specifically for you. So anything you need, all you have to do is reach out. So guys, I hope that I have brought this information that you can use, and I hope that it's useful for you. So if you like this video, please like, share, and subscribe. And know, of course, that we are thinking about you. We want everything for you, the best of health, the best life. Just stay compliant, stay positive, and remember, this too shall pass. So I'll see you on my next video, guys. Take care of yourselves. Bye.